Hey guys, and welcome to Money Talks News, the podcast. It's the podcast that makes you richer one day at a time. I'm your host, Stacey Johnson. I started Money Talks News in 1991, 35 years ago almost. Oh my God. And with me, not all that time, but a lot of that time, is our managing editor, Carla Boucher. Hey, Carla.
Hello.
Carla just wrote this super cool article. I really liked it, and you should see it too. As a matter of fact, go to Money Talks News and read this article. It's called 7 Ways the New Congress Wants to Transform Healthcare as We Know It. Anyway, it's on our website. You should read it. But in the meantime, we're going to try to summarize it for you in 10 minutes. Actually, maybe we can do this more than one podcast, but we're going to try to summarize it for you so you can understand what might be going on. Background. We know that Trump almost certainly wants to extend the tax cuts that he put in place in 2016 that began in 2017. Now, in order to do that, though, a lot of people are saying, because this is going to make the deficit big, right? What is it, 2018?
They passed it in 17. They started in 18.
Okay, whatever. Anyway, we know that he wants to extend the tax cuts, and we know that some Congress people, many people, as a matter of fact, on both sides, they all probably, want those tax cuts to be paid for so it doesn't increase the size of the deficit, right, Carla?
At the least, I would hope.
Okay, so what we're looking for then, or what they're looking for, is ways they can save money to help offset the tax cuts that are going to be proposed shortly. And some of those ways are going to affect healthcare, and that's what we're going to talk about today. So, Carla, I'm going to start you off and just go down your article here and say some, and mention some of the things that you mentioned in the article. Now, again, to be very clear, folks, these are not going to happen. These are talking points, right, Carla?
Well, it's things they want to go in the bill. Whether some of them cost money, some of them save money, but they have a 50-page brainstorming document, basically, because they know that whatever goes in that bill has to be a balance of costs and savings.
Okay, cool. So let's get down to brass tacks. One of the first things you mentioned in your article is eliminating Medicare coverage of bad debt. What is that about? So
currently, if someone is on Medicare and they, when you incur an expense at the hospital, Medicare pays part of it. There's going to be usually part of it that you're paying. And if people don't always pay that, and currently Medicare, the program reimburses healthcare providers for unpaid balances that for people who had Medicare. They call it Medicare bad debt, basically unpaid debts by a patient who had Medicare. They currently reimburse them up to 65%. And so this proposal is to ease out of that, and they would gradually lower the amount that they reimburse until they have eliminated the concept of Medicare bad debt.
Interesting.
So the program would not be reimbursing providers.
Okay. Quick example. And your father's a doctor, right?
Yes.
Okay. So quick example. I go to the doctor. Medicare pays 80% of my doctor bill, but I'm responsible for the other 20%. Right. Okay, so I spend, the doctor bill's $100. Medicare pays 80, but I'm responsible for 20. If I don't pay that doctor that 20%, then that's a bad debt. And that's what Medicare pays 65% of now. And that's what they're proposing. Again, just an idea that they have, to reduce the amount that Medicare reimburses that doctor from the debt that I didn't pay. Is that an accurate description?
Yes. And this is the biggest deal for hospitals more than individual providers, because your doctor, if you don't pay your debt to a doctor, he's probably not going to have you back. And so it's easier for them to, curtail their losses, if you will. But hospitals, particularly with safety net hospitals, this is a whole other matter. So this is potentially a lot of money they can lose out on.
So if Medicare doesn't pay back that doctor or that hospital, how much is that going to save Medicare?
The estimate from the Republicans in Congress who came up with this is $42 billion over 10 years. So some billions of dollars. That's a big deal for the Medicare trust fund. Medicare has 2 trust funds, one for hospital insurance, one for outpatient care, basically. Okay. And the one of them is in very good shape. The other one's currently estimated to be depleted by 2036. So if you can make a change that saves billions of dollars for the Medicare program, doesn't really affect patients on the surface of it, at least, that's a huge deal. They can improve the solvency of the program. But
And when does Medicare, when does it run out of money? Is there a date?
yes, one of the two trust funds is indefinitely funded. The other one has a estimated depletion date of 2036.
So this would extend that then by saving $42 billion. This would extend that. So this is good for those of us who are on Medicare, which includes me.
Right. Anybody who will be on Medicare in the future as well.
Okay, so that's a good thing. Now, next thing you've got is adopting site-neutral payments by Medicare. I don't know what the heck that means. Tell me about it.
Okay, so there's certain procedures that can be done in a doctor's office, but they can also be done at a hospital's outpatient or at a surgical center. And one of those is colonoscopies. Currently, Medicare pays a different amount to the person and the entity that did the colonoscopy based on whether it was done at your doctor's office or your hospital's outpatient department. They pay a lot more to the hospital outpatient department than if you go get that done at your doctor's office, even though it's the same procedure, exact same thing. It's just the location. So
now, in your article, you say it costs $1,000, and this, I guess, is just an example. $1,000 for a colonoscopy in an outpatient department, $600 performed at a surgical center, and $345 in an office. Right, same procedure, 3 times the money the hospital gets.
Right. Those are estimates from AARP as of 2023. So those are pretty spot on.
And so what's the idea here? Just to pay everybody the same amount?
Yes. And they do not overtly say this, but it looks like because they estimate this to save $146 billion, they don't say this explicitly, but I believe the plan is to give everyone the lowest rate. So everybody would get $345 for your colonoscopy. You know, your doctors wouldn't be affected; he'd be getting the same rate. But surgical centers that do it, hospital outpatient departments that do it, they're getting a lot less money for these procedures. So
that's going to make them mad. It's going to save Medicare a lot of money.
It is. $145 billion, you said. Is the estimate in 10 years.
146, yeah.
And even if that's wildly off, you're still talking about saving Medicare billions of dollars.
So that's another way they're making Medicare last longer and not hurting us as patients, right?
Technically. I mean, both of these I think both of these will have unforeseen consequences down the line.
And before we get to those, and I want to get to them before we're done, we got another couple of minutes, but they're also expanding Medicare coverage, or at least, again, things being discussed to expand Medicare coverage. So we've talked about things that are making it worse for the provider or saving money for Medicare. Let's talk about ways that Medicare is going to get better, that's going to expand services.
Right. So they mentioned a number of Medicare-related bills that they stalled in Congress over the last 2 years, and someone in Congress is currently proposing making them law. And so one of them, a big one, would be extending Medicare coverage of telehealth, which for the most part ended last year. And
so that's good, telehealth, yeah.
So some of these also affect access to hospitals and emergency ambulances in rural areas. 3 of these bills have to do with making it so that cutting-edge technology and devices can be covered by Medicare sooner, like as soon as they're approved by the FDA, which is currently, it takes a lot longer for a new technology to come out, and then later Medicare comes around to covering it.
So this all sounds good. We've got 2 ways of saving Medicare money, and we've got expanded services for Medicare. So rah, we win. What unintended consequences do you think might occur?
Well, these bills that are expanding coverage, anything that expands Medicare coverage is going to cost it money. The estimate for these 5 bills that we're talking about is $20 billion over 10 years. So, they need to that's an added cost they would have to make up elsewhere. And then the first 2 items that affect how much money healthcare providers and hospitals get, they're not going to take that loss of revenue lying down. Healthcare in this country is a big business. And so I suspect that you'll see changes in policies or pricing at doctors' offices, particularly at hospitals, maybe they decide to stop offering colonoscopies, and now your only options to get it at the doctor's office. Maybe that doesn't matter, but that's an option you might lose. They also hospitals, if their Medicare bad debt is no longer covered, they're going to make that loss of income up somewhere else. Maybe,
and even a regular practitioner, if they're not going to get reimbursed for those losses, is it possible they might just say, "I'm not going to take Medicare anymore"?
That is another one. And that to me is the scariest one. And then what happens if you have more providers backing out of accepting Medicare altogether? Someone on Medicare who wants to go, it's always the best doctors first that back out. So if we could be looking at a situation where if you have Medicare and you want the best doctor for some problem that arises, and it turns out they've decided to back out of Medicare, your only options are paying entirely out of pocket to see that doctor, or not going to that great doctor. So that is a. I think you're going to see various ways that various types of healthcare providers will make up their revenue or ensure that they do not incur losses going forward.
Well, we're living in a very interesting time, aren't we, Carla? There's all kinds of stuff going on. I mean, there's so many things going on almost on a daily basis that it's really hard to keep it all straight. But thank you so much for writing that article. And again, you guys go to moneytalksnews.com. There's a lot of stuff we didn't have time to discuss. And we're going to do another podcast with yet more things that could change with our health care because of these new laws that are going to be passed soon. So anyway, stay tuned for that one. In the meantime, go to moneytalksnews.com. If you're not a subscriber, subscribe. Read Carla's articles and everybody else's. And follow us on social media too. And tell your friends. This is a great podcast. Tune in again. We're going to see you right here next time.